In the VA, we have a continuum of care with inpatient mental health at the very highest level of intensity. The need for inpatient care is rare, but when it's needed, it is literally life-saving.
Inpatient is where we admit patients who have mental health issues who are not safe enough to be on the outside. They are not safe enough to stay home.
Someone might need rehabilitation care, physical rehabilitation for a chronic condition. They might need evidence-based psychotherapy, which is available as an outpatient, but you can get it in a more concentrated form in an inpatient setting. And then there's a very important transition when you're leaving to make sure that you're safe, not just as you step out the door, but in the next few days to week afterwards, where we make contact, make sure we have a certain number of contacts within the next week and the next month in order to follow up with you. The other thing I would mention is that it's not always dignified to be compelled to be in an inpatient unit when you don't want to be, even if it's for your own good. So the dignity that is offered to veterans in that situation is critically important. It's not a prison. You're not there because you've done something wrong, because you've broken a law. You're there because you need help.
It's a multi-pronged approach, working with communities, working with the veterans, working with the families, monitoring them, having that support. We kind of hold their hands until they don't need us to hold their hands anymore.